What is evidence-based practice? Evidence-based practice is a problem-solving approach to the delivery of healthcare that integrates best evidence from studies and patient data with the clinician's expertise and patient preferences and values. Healthcare that is evidence-based and conducted in a caring context leads to better clinical decisions and patient outcomes. Gaining knowledge and skills in the evidence-based process provides nurses and other clinicians with the tools needed to take ownership of their practices and transform healthcare. What is a PICOt question? The PICOt question, P-I-C-O-T, the PICOt question format is a consistent formula for developing answerable, researchable questions. Writing these questions is deceptively simple. When you write a good one, it makes the rest of the process of finding and evaluating evidence much more straightforward. As strange as it sounds, deciding you are looking for related to your outcome can be one of the hardest parts. When you determine the outcome, it helps you to hone the process of searching for the evidence. Remember, evidence is not just what you want the outcome to be, it is evaluating the evidence supporting or refuting what influences the outcome. For example, if you are interested in getting to the actual reason of the effect of testing Foley balloons on the rates of UTIs, then you need to find evidence on both the pros and the cons of testing the balloon. How do I write a PICOt question? Step 1. Create a general question that you want to study based on a specific scenario you have experienced as a healthcare professional or even as a student. For example, in older adults with wandering behaviors or pacing, is music therapy an effective modality for decreasing the wandering and pacing behaviors? Step 2. Choose your patient population for the study. Factors to consider include age, gender, health conditions, medication regimens, and access, to name a few. For example, P, population, older adults over the age of 65 who have dementia. Step 3, determine your intervention. The activity you will undertake for your specific patient population. Since you are basing the research on evidence-based practice, you need to compare this new and different technique to an existing practice of the facility. For example, intervention, I, the use of music therapy modality. Step 4, choose your comparison group. Patients who will not experience the new intervention. For example, C, comparison group, current practice, or no music therapy, or what is often referred to as traditional care. Step 5, predict the possible outcome of the question you are examining. Since you are grounding your research in evidence-based practice, you are using the study to predict your predetermined belief of the outcome. For example, O, outcome. If you are looking at the impact of music therapy on wandering and pacing behaviors, for example, you may believe the outcome will show less wandering or pacing behaviors for those who are exposed to music therapy from those exposed to traditional care, i.e., no music therapy. Finally, select the time frame during which you will study the impact of your intervention on the population. For example, T, time, the study could last 1 month, 3 months, 2 weeks, or 4 weeks, depending on the needs of the unit or purpose of the study. So for our PICOt question example, P, population, older adults over the age of 65 who have dementia. I, intervention, music therapy modality. C, comparison group, traditional care or those who are exposed to no music therapy. O, outcome, decreased wandering or pacing behaviors. Little t, time, in a 2-week period.
Created using Powtoon.